Okay, so this is really the end. I think there may be two more slides. No, this is just one. But so tried to come up with a name for what we do here, so we called it Denver's Diet Doctor. And what we're trying to do is really redefine healthy nutrition, rebalance that food pyramid, which is carbohydrate heavy. We want to tip the scale where we reduce carbohydrates, increase protein and healthy fats in the diet, teaching patients how to make healthy food choices based on the glycemic index that is not on the food label. I heard in the UK there's a health store that may have the glycemic index on their food products. I think it needs to be everywhere. We can teach patients to count the grams of carbohydrate. We're going to increase the protein and fat in our diet, and we don't worry about it. But we do have to make sure that we don't eat carbohydrates. It is that killer combination that we have to worry about. We want small, frequent meals, lots of liquids. And again, the focus is not the quantity or the portion or the calories that we consume. It's the quality or the choices of food that we make. And if we make the right choices, hunger and appetite will be controlled. And I call that the physiologic edge. And that's why I had to go through all that mumbo jumbo in the scientific part of the lecture to explain the physiologic edge. Sorry about that. So we want to exercise, both cardio and weight. Supplements are important. You want to go to a healthcare professional that really understands glycemic index and what the goals are. Because once you start mixing ideas and concepts together, you're going to bring fats, cholesterol, and carbs together, and you're going to be spinning your wheels again. And of course, we want to monitor the markers of inflammation. We want to come up with a personalized program. And the goal is longevity. That's it. Just like we treat your other medical problems, we're trying to keep you healthy and well longer. And so my favorite line, good food is good medicine. And this really represents the glycemic foods. So thank you. That's all I have. We'll take some questions, please.
I've got a comment and a question. The comment is general. I wish that somebody from Holly Creek's nutrition staff were here. Maybe they are, but I don't see them. Because I feel like our meals are very heavy on carbohydrates. There's always potatoes and rice.
Are you sure they're not in the room right now?
I'm not sure.
Okay. Are there any nutritionists here from Holly Creek? I don't think so. So I don't even need to look at your menu, and I know that there's too many carbohydrates in it.
Yeah.
And it gets us back to the issue. It's so hard to make change.
Well, it's a financial thing too, I think. I believe carbohydrates are generally cheaper than
Did you hear that?
high protein.
Carbohydrates are cheap, profitable, and we're supporting our food industry at the cost of our health. That's an excellent point.
The other thing is a personal question. I'm not overweight and I'm not diabetic, although I have some parts of me think I'm a diabetic, specifically my feet, but I'm not. But I'm concerned about what you said about inflammation, because I would think, I don't understand how the diet contributes to, for me, I don't understand how what I eat contributes to the inflammation that I have in arthritis.
So it's a great question. It brings us back to insulin resistance, which is the inflammation. And the inflammatory macronutrient is the carbohydrates that we consume. And so in those studies where we were comparing, it was actually comparing a high-fat ketogenic low-carb diet to a Weight Watchers diet, and to a Dean Ornish, a very low-fat, high-carb diet, and they measured those markers of inflammation. The one slide with the cytokines, those hormones directly affect arthritis and the inflammation that occurs in your joints. And so, again, removing the inflammatory fuel, the carbohydrate, ultimately treats the inflammation. I hope that answers it. You still look puzzled.
It does, except that I eat very few of the carbohydrates.
So it helps to, you know, we want you to continue to live the healthy lifestyle that you're living, because long term it's going to help all those, it's going to help the arthritis, as well as taking supplements, taking fish oil, and of course, if you need medication, you need anti-inflammatories.
Yeah.
You know, allopathic medicine is wonderful. We want to treat and cure so many conditions through traditional medical therapy. So this isn't a godsend. It's not going to save us all, but we're definitely not in the right direction. And the goal here is to get us going in the right direction.
Is there any place where we could get a listing of the high carb foods that we should avoid?
Sure.
Is,
The glycemic index chart is everywhere. You can buy it in a book.
okay,
If you get on the internet on my
I
website.
don't have one.
Ah, okay.
I don't have a computer.
Yeah. Well, the other thing is I can just send you one, which is really easy to do.
Oh, that would be
So
wonderful.
Kathy can help me coordinate and get a glycemic index chart to you. But do you peruse the bookstore? You just get.
No, well, I
Oh.
don't now.
Yeah.
No, and
So-
I have trouble reading also,
Ah.
my eyesight.
Right.
So,
But it's everywhere. So I didn't
Okay.
invent the glycemic index chart. It's been around for a long
Because
time.
it's
And it'll-
mainly starches
Right.
and sugar and,
I
I
don't
mean, I
think
think I, pretty much have learned.
My comment is that the grain, corn, and wheat industry is killing us. And as from that, you get the breads, pasta, potatoes. When you look at glycemic index of whole wheat compared to white bread, it's just as bad.
It is.
So whole grain,
Just no
maybe have a
grains.
little whole grain. So
Okay, because they say whole grains, beans, that's our beans.
right, beans have a lot of protein, a little bit of carbohydrate, and so we always say beans would be a better choice than rice.
Okay,
So
thank you.
great questions.
So,
Good.
what do you suggest for preventing your energy drops? I mean, eating every couple of hours, or what
Right,
do you
so
do when you get so
I'm
fatigued?
experiencing that myself, and I have found that there's a direct correlation between the meal that I eat, how much carbohydrate is in it or not. The more carbs I eat that meal, and I crash. You know, after Thanksgiving, we call it the food coma. And it's really, I mean, yes, there's an issue of quantity of food there, but it's the carbohydrates that we eat at Thanksgiving that drive the hunger, and then we have that food coma at the end of it. So the way to control that is to reduce carbohydrates when you eat.
Any food that's particularly helpful when you do have that drop in energy?
I would say to drink a lot of fluids and just have a low glycemic snack. I don't know that, that's a good question. So that there's a particular food that would be an energy booster in that particular situation. I would tell you fight it and go out and walk and exercise, and don't let yourself get that way. And then
But
actually-
eating bananas and things like that, that's not particularly,
Right, so in the old school, that was a wonderful short-term solution.
yeah.
Oh, well, we'll just pound in some carbohydrates and some caffeine, but that's just worsening the problem. You're going to crash even harder, an hour later. So, but regarding the issue of energy, so we have patients that like to go to the gym and exercise, and they ask, well, what's going to happen to my energy when I cut the carbs out, because I'm used to eating all these carbohydrates and bananas before I go to the gym. If you stick with the program, eventually your energy level just hums along. It just becomes stable, and you have longer exercise tolerance. And I've had experience with that when I played tennis. I've lost weight in the past, and I remember I used to go out there and I'd have to have energy bars and carbohydrates every 10 minutes, and I saw my friends that weren't overweight, they could just go for hours. And so now, I'm just that way. All I do, I go out to the tennis court with a bottle of water, and I can go for hours because my energy's better regulated now that I've learned to eat better.
Mhm. So a low-carb diet, eventually you'll come up with more energy?
Yes. And this, again, a recommendation for life is that if you're not trying to lose weight, you want to reduce carbohydrates. You don't have to eat low carb, but just the concept of less carbohydrate, and that will help to maintain your weight and your health.
Mhm. But to lose weight, you definitely have to cut back carbs.
Yes, absolutely.
What is the recommended amount of carbohydrates per day?
Well, again, it depends on your goals.
If you want to lose weight, though.
So we don't initially discuss that with patients because then
Okay.
it starts sounding like a diet when we start counting the grams of carbohydrates. We just focus on glycemic index. But since you asked the question, if you have to lose weight, we generally tell patients if you eat between 40 and 60 grams or less of carbohydrate per day, you're going to have a good chance of losing weight.
Okay,
So that's kind of a starting point.
thank you.
So, Katie, you had a question?
You mentioned exercise, and I was wondering, you said cardio and weights, and I was wondering, what do you usually tell patients per day? How many times per week? What do you suggest?
So first thing is 50-50 on cardio and weights. And so the studies show that both are important. You don't have to run miles and miles and miles. You have to actually do both. And the American Heart Association recommends cardiovascular 3 to 4 times a week, 30 to 40 minutes. So I believe that's a good recommendation, plus doing some weightlifting. Okay, guys, I think we've probably run out of time. So those are great questions, and thanks for your